everybody, this is Azar, physical therapist. Today I'm going to talk about the knee injuries and how we can treat the knee with physical therapy. First of all, I want to show you the structure of the knee and anatomy of the knee a little bit. I'm going to start with the joint, the knee joint, and how it can work. As you see, it's a hinge joint and is supported by the ligaments and meniscus. Meniscus is the one that's carpeting the floor of the joint and giving a cushion to the joint, and ligaments around it can cause a lot of stability on that joint. As you can see, the knee joint is a hinge, so it's not ball and socket, it doesn't have a stability, and it rubs against each other. The femur bone and the shin bone, they can rub against each other a lot if we don't have good support of the muscle and the ligaments. So it's very, very important for the knee to be healthy. If we want a healthy knee, we want to have a lot of good muscle strength and ligament stability. It's not on the hip like that, because the hip was a very stable ball and socket joint, and the knee is not. So the knee needs a lot of muscle. First thing first, we have to have a good quadriceps muscle. The big muscle that has forehead on top of the shin, it's called quadriceps. This is a quadriceps muscle. As you can see, the big muscle that's made out of medial and lateral and anterior muscles. So it's like a forehead, that's why we call it quadriceps, attaching to the knee joint. But at first, we have to know that when it attaches to the knee joint, it does not attach to the whole joint. It has attachment to something we call kneecap. I'm going to show you the kneecap in the picture. Right here, as you can see, underneath that muscle, that ligament, that's attachment of the muscle, we have a little sesamoid bone, small bone, round, and that moves. So I'm going to show you how you can find the patella or kneecap in your body. When you can put your hand in here, something moves really, really freely. That's the kneecap. And it has to move freely. You might feel, oh my God, it's so unstable, I don't like it, it moves a lot. But it has to move. That's the only part that has to move, because it's attached to the tendon of the quadriceps, and if it does not move, the tendon of quadriceps gets so tight and cannot do all the bending and extending movement freely. So it's like a leverage here, and that's like something that holds on in the middle of the leverage to give you a better ability to freely do flexion and extension. So it has to be there. So, but sometimes the muscles around it can get too tight. So when you start moving that kneecap, you feel that stuck. It doesn't move, especially in one side. If that's the case, then it means that one side of your quadriceps muscle is stronger than the other side, or tighter than the other side, and the other side is looser. So if we have that imbalance between the inside and outside of the quadriceps muscle, we can get problems in moving freely the kneecap, and it can cause a lot of problems down the road, especially with squatting and with taking stairs and stuff like that, that needs a lot of flexion and extension of the knee freely. And it keeps continuing and you don't get treatment, you can develop arthritis in the joint surface of the kneecap. So the kneecap does not get movement freely, and it keeps rubbing and rubbing because it's so tight while it tries to move, and then that rubbing can cause erosion in the bone, in the joint surface of the kneecap. That's how you can get arthritis in the patellofemoral area or kneecap. This is all about patellofemoral, and we have another joint in the knee which I already talked about it, and this is a real joint. So this is the joint, the patella joint area in the top, and this is a real joint in the bottom. That's the joint line, and that's where the meniscus are located. So if you feel the pain and tenderness in the side of your knee right here, that's not the kneecap anymore. That's the real joint of between the femur, the big bone of the thigh, and the tibia, the big bone of the shin. That joint is very, very more even important than the patellofemoral joint, because this is a real joint that takes all of the vertical pressure of your body, all your body weight. So if we have erosion erosion inside that, or a meniscus that's carpeting inside the joint gets tear, so we don't have enough cushion anymore, or if you get arthritis, so we don't have enough cushion of the cartilage in there anymore, then it's gonna be a big huge problem, which is the knee arthritis. If we don't take care of it, the next stage will be knee replacement. So we have to have again the metal knee, metal on metal, to be able to help the body not to feel the excruciating pain because of the erosions of the bone on bone. So the first thing first is a strengthening, like the other structures of the body. We have to strengthen the knee. You tell me that, oh, I'm walking and I do sometimes jogging and I think it's enough. I do a bend over and do stuff at work. That's enough. And I'm going to tell you it's not enough. Sometimes it's even damaging if you walk around without good muscle strength, or without good changing the alignment of the knee that's wrong, which we talked about it in hip section. If you go back to my previous videos, 2 videos from now, 2 videos back, then you're going to see the alignment issues. Sometimes the alignment issues in the hip can cause knee problem, erosion on the one side of the knee more than the other side, and tightness in one side more than the other side. So very important to fix the knee, the muscles and the alignment and all of this before you start walking on it and jogging on it and playing basketball or volleyball or football and soccer and stuff like that. And you have to have a good strength and stability of the knee before that. If not, definitely you're going to injure your knee very faster than other people. So first of all, strengthening. The first thing for strengthening is really easy. You can sit on the chair, and that's going to be strengthen your quadriceps. This is a big muscle that needs to be strengthened for the knee people. So the first thing first, you can sit on the chair and just bring that knee up. We call it long arc quad exercise. So it's a long arc. So the arc starts from here and goes all the way up and hold up here until you get strengthened in the quadriceps. Hold it for 1, 2, 3, 4, 5 seconds, back down. Very easy and effective exercise. You probably don't think it's going to be effective on your knee joint, but it is very effective. Another thing you can do, I can go ahead and show you another way of doing that with adding a weight. So I'm going to add the weight to that same exercise. In my case, I have a 2-pound weight, but you can add more or less depending on how much you can tolerate. And then bring it up with the weight. That way you can use the weight as an extra strengthening tool to that muscle. But you gotta make sure that you're all the way back in the chair, so you have a good leverage and you don't have any shearing force. But sometimes this is not the appropriate exercise to do, and I'm going to tell you why. Sometimes the kneecap and ligaments, which is we call it quadriceps ligament. That's like a continuation of your quadriceps muscle, which is either the quadriceps ligament or sometimes we call it patella ligament because it's attached to the patella. That ligament right here, that gets tear or a lot of inflammation. If you have that problem and you keep going like long arc quads with the weight, which is in the gym also. We have a device in the gym, you probably have seen that machine in the gym, all of you, that it can add the weight to this and go all the way against the weight. That can cause a lot of damage to the kneecap. So we want to hold off on it if you have a lot of kneecap problems, or if you have a patellar ligament issue. So that's the no-no for this kind of people. For a lot of other people that they have arthritis on the actual knee joint and the meniscus issue or other ligament issue, other kind of problems, then this is very important to do it because you want to strengthen the muscle around it to help your knee to get stabilized. Another exercise that's very important for you to do, you can do it as a short arc, which is making it more and more safer, very safer actually. How I can do that, I'm going to show you different ways again. You can put this something underneath your knee and then go all the way up just like that. You see how my arc is short? It's only 30 degrees versus the other one that was 90 degrees. So only 30 degrees, hold right here and relax. Or you can again do with the weight. Okay. If you don't have this, I can recommend you just roll a towel, which I have a towel here to show you also. Just easy like that. Just do it with the towel roll. Okay, that's a short quads, very important exercise. Sometimes you have a problem between the inside and outside of the joint. So if you have that problem, if one side of the quadriceps muscle is stronger and tighter than the other side, what we can do, we can grab a pillow, which I'm going to get a pillow from here, or a ball. I'm going to show you the pillow because you might not have a squishy ball at home. But you all have a pillow or cushion. So you're going to put both legs on top of this and you're going to press the pillow while you go up. Okay, you can also add the weight. Press the pillow, go up and down, 1, 2, 3, 4, 5, down. I can show you the other side so you can see better. Press the pillow between, go up, 1, 2, 3, 4, 5, down. Okay, got it? This is the short arc quads. This is very more safer and is very less damaging to the patella or kneecap. So you have to be very careful. If you have patella or kneecap issue, don't do the long arm, do the short arm. So these two exercises very important. The third one, we call them open chain exercise because the bottom part of the limb, which is this top part of the limb, is open in the air, right? So we call it open chain. If we want to be safer, we want to do safer quadriceps strengthening, it's another way to do that too. It's a lot of other ways actually. The first way is like this. So you're going to grab the elastic band, put it on somewhere that's sturdy, okay, in the leg of a table or something. And then you stand like this. I'm going to show you this side so you can see better. You go a little bit lower than the knee joint. Okay, you stand back here and we go like this. Let it get loose and get an angle, flexion angle on your knee and then bring it back. 1, 2, 3, 4, 5, relax. 1, 2, 3, 4, 5, relax. If it's too easy, you can go more back. 1, 2, 3, 4, 5, relax. That really gives you a good strengthening exercise on your quadriceps muscle in a closed chain. So you see the end of my limb is on the floor, so it's closed chain. So it's very less damaging when you have a patella or kneecap issue. What else you can add to it? You can open your legs to have a little bit of external rotation. Remember that? When you do external rotation, open the hip a little bit. We're going to have a better alignment. For most people that their hip is going in, so we have to open the hip by opening the knee like this and go like that. That way you can get a very better alignment, and then your glute also will work, glute medius, which as we talked about it before, the glute has to be engaged if you want to correct the alignment while you're exercising. Okay, that's going to be a terminal knee extension exercise, very important one, very easy one and very effective one on your quadriceps. Another exercise you can do the simple squat. I can show you how to do the squat, like I'm going to make that a little bit here and I'm going to show it on the door. We call it a doorway. Or wall squat. I'm in the wall, I'm going like this. I'm gonna go ahead and stand like that to the wall. My feet's in the front, as you can see. Hopefully this is not a problem. Okay, that's better. I'm gonna stand back to the wall like this. Okay, my feet's forward. I'm opening my knee a little bit and I go like this and that. Go down, hold it, and relax. Again, depending on what part of the muscle needs to be strengthened of the quadriceps, inside or outside, what we're gonna do, we're gonna add the band to make it more effective. So, if I want my glute to get stronger by doing this, I'm gonna put the band on a little bit higher than the knee, okay? And I'm gonna stand like this, opening against the band. That way I'm strengthening my glutes also, right? And that's the squat, the wall squat with adding the glutes. So it's not the quadriceps only, it's the glutes added also. Very effective exercise, okay? Next exercise I can show you is the knee stretches and other strengthening also. I'm gonna show you the strengthening first of the hamstring. We can do strengthening of the hamstring in two positions. One is in the standing. So again, I'm gonna add that weight to my foot. And what I'm gonna do, I'm just gonna go like this. We call it hamstring curl. We strengthen our hamstring like this, okay? That's a very easy and very effective exercise. Okay? Very easy and very effective. But there was another way of doing the hamstring, which I'm going to show you right now. You can lay on your stomach. Again, add the weight. And strengthen your hamstring like this. Okay? Depending on what position you're more comfortable, you can pick and choose. Another way of strengthening the knee is not only the knee that needs to strengthen, as we talked about, sometimes the glute also. So remember that, friend? Sideway. We can do this. Okay. That's the glute strengthening, the glute medius. Very important. And if you want to strengthen glute maximus, you can do it this way. You probably remember this from the other sections. These are repetitive exercises, but important. So, if you want to have a good knee, again, you have to have a good hip also. Everything starts with proximal. So, proximal joint, which is the hip, needs to be aligned and needs to be strong. Now we're going to cover a couple of the stretching of the knee. We have been covering the rectus femoris stretch before. I'm going to show you it again. This is repetitive also. So I'm going to try to go quick. So we're going to pull that. Very important for people that have patellar issues. So if their kneecap's stuck and not moving, most of the time, the quadriceps muscle, and especially rectus femoris muscle tightness, is responsible for that stocking of the patella. So you do this to release that patella. And if you keep doing that, you can just self-assess after 3 or 4 times of doing this. and see if your patella moves any better, especially when you go up and down. Okay? If you have a tight quadriceps, again, your patella is going to stop. Another stretch, another way of stretching, this is going to be like that. Which a lot of patients, they don't have enough time to lay down, so they want to do it in the office, they want to do it anywhere they are, stretching the rectus femoris, which is part of the quad muscle, and it's also a hip flexor, but it's a knee extensor also. So in this particular video, we are more aware of the knee, and we are more worried about the knee problem. So we're going to cover the knee mostly. Another exercise, which is probably the last one, is going to be stretching the IT band. I'd like to show you a picture of IT band first before I start. This is the IT band muscle, right in here. Hopefully you can see. Follow it from the buttocks, the side of the buttocks, down to the knee. You see that? The red muscle? That's a very, very important muscle that people usually have it very tight. A lot of people, especially the runners and walkers, we call it runner syndrome. And it's located right in here, towards the front, right in there, attaching to the knee, right? If that's tight, which is like a 60-70% of the time or even more for people that come with a knee problem, they have very, very tight IT band. They don't even know that's responsible for a lot of friction forces in the outside and a lot of lateral meniscus issues and a lot of pressure on the cartilage. Sometimes they don't even know that they have it tight. So we're gonna show them and I say, yeah, it's really tight. We're gonna start massaging here for them with the finger and they're gonna start saying, ouch. Yeah, it's really tight. And it's all the way tight to the top. So that's again the two joint muscle passing the hip and the knee. So we have to be worried for the hip and for the knee problems if you have an IT band tightness. But mostly for the knee problems. Again, for people that they have the internal rotation of the hip, as I told you before, they probably have a knock knee, as I can show you here. For these kind of people, we most likely have a lot of tightness in the IT band, because imagine the IT band's not getting enough stretch, so they probably have a lateral meniscus issue because they like this, right? So what's the solution? We try to do the external rotation of the hip and use the glutes instead of overusing the IT band. These kind of people, when they do that stuff, they only use their IT band. When they walk, they run, they overuse the IT band. They don't even use the other part of the quadriceps muscle. So for that problems, we have to really release the IT band. So the first exercise to release the IT band is like that, in standing position. You're gonna go like a cross, one leg in front of the others, and then go like this, and all the way feeling the stretch on the IT band all the way to the knee. Some people feel it more effective when they do that in the back. Depending on how the fibers of the IT band travel in your thigh, you can do it this way or this way, right? But very, very more effective way of doing that, which is also the massage of the muscle along with the stretching of the muscle, is going to be with the foam roll. I'm going to show you right here with the foam roll. So you're going to lay down on this, on that little foam roll, and what we're going to do, we're going to try to release this muscle here. Bring your body a little bit towards the front, so you turn a little bit forward. And then you go all the way, stretch that IT band down to the knee joint, right? So that's going to be the very good IT band stretch, very effective. And if you have problems in the hip and in the knee, you definitely want to make sure that you don't have a tight IT band because it's really common, especially for people that walk and run a lot and they have a alignment issue on the knee or hip. That was it. I tried to cover as much as knee exercises that I could. This is not mostly specific for any acute injuries. These knee exercises are for people that feel a lot of nagging pain on like instability or weakness or tightness on the knee, but you have to try to be diagnosed first. So you cannot probably self-diagnose yourself. You have to go to physical therapy or doctor to get diagnosis. But I kind of gave you some hint if you have a tightness here or if you have a patella or kneecap that's too loose or too tight. So you can kind of figure that out, but not completely, especially if it's really after surgery or if it's something very acute or either tear of the ligament, like a cruciate ligaments or tear of a meniscus or like a dislocation of a patella or something very serious. Make sure you don't only go by the videos. Make sure you go by the advice of your doctor and physical therapist. And then after you get stronger by very more manual therapies, ultrasound, laser therapy, cold therapy, and stuff like that, and you can decrease the inflammation and decrease the pain. Then you can start, of course, doing all of these stretches and strengthening exercises to make sure you can have a proper, aligned, and strong knee joint. Thank you for watching and have a great day.